The single leg squat is a functional test for assessing lower limb function and is a way to prevent and predict injury in athletes. The purpose of the single leg squat is to measure the strength of the lower body, particularly the quadriceps and gluteal muscle groups and the hip stabilizer muscles. The single leg squat test is a reasonable tool to use in sports physical examinations in order to assess dynamic knee valgus and any potential risks to the lower extremity injury. Materials one can use to perform this assessment include colored tape in order to leave clear markings for the client on the floor, and a goniometer in order to measure the degree of flexion in the knee, hip, and ankle joints. So we're going to start off bringing one leg inside the T, line it up. You're going to stand on one leg for me. Keep that knee flexed to 90-degree angle. I want you to hinge at the hips to a 45-degree angle. And then come down to a squat. Try to get to around 60 degrees and back up. Perfect. Common errors to avoid during the single leg squat are excessive forward trunk lean, which often indicates weakness of the hip muscles or poor core stability. Knee valgus, which may indicate weakness of the hip adductors or poor hip control. Loss of balance, which may be caused due to poor proprioception and weakness in the ankle stabilizers. In addition to those three, there's also limited depth of squat and excessive movement and compensation. Some individuals may compensate for weaknesses or imbalances by shifting their weight or altering their movement pattern. Some factors that may affect the results of the single leg squat include the client's footwear and surface. Wearing inappropriate footwear or testing on an unstable surface can affect balance and stability of the squat. In addition, we can also take into account age and physical condition. Age-related changes in muscle strength, joint stability, and balance can influence performance on the test. Experience and skill level. Individuals with more experience or training in strength and balance exercises may perform better on the test compared to novices. And finally, previous injuries or pain. Individuals with a history of lower body injuries or ongoing pain may exhibit compensatory movements, patterns, or hesitancy during the test.